Now, when we talk about someone's attitudes towards death and dying, there are certain factors that seem to play a bigger role than others. So essentially, context matters, or these factors, outside factors, matter. The first factor that matters is the nature of the disease. So, for example, the course of the illness. Now, there's not one right answer here, one right path, but just know that this could shape how someone views the death or dying process, the symptoms involved. I think, for example, if someone is having a lot of pain, if someone is having a lot of pain, then it might be a situation where they're like, I don't want to live like this. This isn't something that I want to face every day. And so then dying doesn't seem as scary because it's a relief from those symptoms. I'm not saying everybody feels this way, it's just giving you one example of how this could play out. Similarly, if someone doesn't really even have symptoms, then they may view death and dying a lot differently because, they're not suffering day to day, and it's just something that's coming with a diagnosis. So the disease itself, it's not necessarily any one particular disease or any one particular type of course of illness or symptoms, but just you have to think about how those different factors could play a role in how someone sees their experience and ultimately shapes their attitudes and behaviors. Just like anything else, we know that personality plays a role here. Coping style plays a role here. It doesn't say this on this particular slide, but optimism is going to play a role. So if someone is particularly optimistic, it doesn't mean that they're out of touch with reality. And instead, what it means is they're focusing more on the positives. And so if somebody is focusing more on the positives, then this is going to lead them to cope better with whatever illness they're facing. Similarly, for coping style, those who are, before an illness even struck, are kind of poorly adjusted. So here, I'll give some examples of adjustment, but, they don't have a good support system or good relationships. They're people who have many negative factors in their life, potentially ones who are more likely to avoid, which is part of personality too. These individuals, when faced with a serious illness, are probably going to be experiencing more distress. They were already experiencing more distress than the average person before an illness, and an illness isn't going to make those things better. Essentially, when we're looking at the individual and attitudes and beliefs towards death and dying, it's coming down to their viewpoints, their worldview. Do they view, death and dying as imprisonment, like I can't fully, do what I want to do and my life sucks? Do they see it as a chance to complete things on their bucket list and to live more fully? To just take advantage of everyday life moments? Do they see it as just part of the lifespan and part of life's journey, or do they see it as like an unfair thing that they have to face? So essentially what you're seeing is that it's complicated, like how someone is approaching death or dying. And this applies here, obviously, for the person who is dying, but you can imagine how this is also applicable to those individuals who are facing their loved ones dying too. Like all of these factors, these cognitive, emotional factors and behavioral factors are all playing a role in how we're going through this experience. And every given day, some of these are going to vary, right? It's not like an optimistic person is optimistic every day. It's not like a person who is usually good at coping is going to cope well every day. It's not necessarily the case that somebody's symptoms are the same every day. And so to study these kinds of constructs and these attitudes can be particularly challenging because it's so complex. But as a whole, that's all of psychology. We're trying to understand these individual factors when understanding any given construct. Along those same lines, the people around us also really matter. So, for example, if we have people around us and we're the one who is going through this dying experience, and the people around us are kind of avoiding the topic or not wanting to talk about it or not willing to acknowledge the illness, that's less than ideal. Essentially, then it makes it so that we feel closed off and we feel like we can't talk about it. So really the best outcome is for people who are close to the dying person to really acknowledge the illness and not necessarily to dwell on it or to always have sad face or anything along those lines, but just to talk about it, to have an open line of communication. There's really no part of human psychology that I can think about where communication is a bad thing. I mean, unless it's poor communication, but just open lines of communication are really, really important. Similarly with doctors, if doctors are kind of not really forthcoming and or as helpful as they could be, if there's not fully clear about the prognosis, this leads to less than ideal outcomes as well. It just leads to more uncertainty. Now, it could be the case that doctors don't fully know what the prognosis is, and then in this situation, there's not a lot that necessarily can be said, although the doctors can be as verbal about that as possible, like, I wish I could tell you more, but I can't. However, there might be other situations where doctors just, for various reasons, don't share fully what's going on. Like, how bad is this really, unless a patient asks. And so, again, this is leading to less than ideal outcomes. Part of this is because of expectations. We've already talked about this so many times in this course. This idea that if you're prepared for menopause, if you're prepared for puberty, these life transitions, then this is going to make it where you have more optimal outcomes. Whereas if you're not prepared, and again, for puberty or menopause and or death, like, I mean, how well can one fully prepare until you experience it, or parenthood, or marriage, or any of those things? But we just know that having clear ideas and expectations sets us up to do better than if we don't have those expectations. In terms of family members, dealing with a terminally ill patient can be really difficult for the caregivers and for other family members as well. And so it can often be the case that those individuals need extra support and counseling themselves. There are lots of grief support groups that exist, and it's not necessarily grief after death, but just grief during the process. Um, I think about Rick's House of Hope is for children and adolescents who have loved ones who, well, it's a grief process broadly. So it could be for parents who are getting divorced, but also for loved family ones who have passed away. And so just in general, can be really, really important that, everybody in the family realizes that we're affected by one another. We've already talked about family systems theory and how there's disequilibrium during times of change. And this could definitely represent one of those times of change. Wanted to talk about one other factor, and that's, well, two factors, but related factors: spirituality and religiosity. So spirituality is like having a faith, whereas when we talk about religiosity, we typically talk about that as like more practicing of faith. And so somebody who, let's say, believes in God and goes to church and also, practices and prays and things along those lines, then they're going to be scoring higher in both spirituality and religiosity. But there are some people who, have faith in a higher power, but don't necessarily practice any one particular religion. Again, so those people would be high in spirituality. And there are people who go to church or synagogue or wherever and, aren't actually deep believers. It's just kind of like something that you do. And when we look at those two factors and how they influence the death and dying process, we know that people who believe in a higher power tend to have an easier time dealing with death in terms of having lower death anxiety. So it's kind of like it's just essentially putting your faith in a higher power and feeling that you'll be taken care of in an afterlife. For religiousness, though, that doesn't protect itself from death anxiety, so just going through the motions of a particular religion doesn't protect you from having those. It's not to say that it's problematic overall, but it doesn't protect you from that same kind of anxiety. It's particularly problematic if you realize that you kind of have some discordant beliefs and behaviors. So for example, if you're like, well, I really do believe in an afterlife or in heaven or in hell, but I don't actually practice in a particular way that is, so I start to question, what my faith actually is. This is kind of like a form of cognitive dissonance in a way. But for those particular individuals, and this can come in many shapes and forms, then it's less helpful in the death and dying process. Not to say that religion doesn't have a role or can't have a role in death and dying, but it's complicated essentially. So this is just one other example. I think because I wanted to talk about this particular factor because a lot of people, when they're going through death and dying, there's a religious community that surrounds them if they're from a religious community, or they start to think about religion in a way that they may not have done before.